But I also know that with a lot of this kind of stuff comes a lot of shame and a lot of guilt and a lot of, I've done this to myself. And one of the best things that someone told me, my manual lymphatic drainage massage therapist, Ian Souls, who I'm sure everyone has either heard about or knows personally, the first thing he said to me when we figured out that I not only had lymphedema, but I had lipedema, I'm laying there on his table and he says, Diana, it's not your fault. And I was like, wait, what? He's like, it's not your fault. Lipedema is got a huge genetic component. I've had this condition likely since I was 13 years old. And then it also has the hormonal components that get worse with stress and potentially pregnancy and with menopause and puberty. And he said, it's not your fault. And if you take anything away from this today, it's to please tell your patients that it's not their fault, because they are internalizing this. They're thinking, this is my problem, this is a me problem, and it's not. It's not something they've done to themselves intentionally. Let's be real, no one wants this. We're not running out and being like, you know what I need today? I need lymphedema. I'm just not gonna move, I'm not gonna do all the things, and most of us don't even know about it. Before I heard those words in that nurse's office saying, I can tell you have lymphedema, I didn't know what it was. I had no idea. I had a grandmother with breast cancer who had lymphedema in her arm. I didn't know what it was. No one ever talked about it. No one ever talked about how to manage it. My poor grandmother went probably the majority of her life without managing it. And so I think we need to really make sure that we're giving people a lot of grace, because this is a really difficult thing and there's not enough education about there's not enough emphasis on it in healthcare, and most of our doctors don't even know. My doctor didn't know about lipedema, didn't know about lymphedema. I started having swelling on my left thigh and they had no idea what was happening. The dermatologist didn't know, my family GP didn't know, and it wasn't until my doctor started doing a little bit of research. He's like, well, you have pitting edema and it's not going away, it's getting bigger. Maybe we need to do a lower limb assessment. And that was the only reason that I got any care at all, and then I got a diagnosis. So there is a lot going on with this, and it's really, really important to make sure that you are you're really supportive of the people going through this, because it's a lot. So my relevant slide for today, I always feel like I'm on display with lymphedema and lipedema. Lipo-Lymphedema, obviously my body size is a lot larger than most because of lipedema, but also my lymphedema means I have skin differences in texture and I have swellings in areas and things like that. And the most brave thing I did was put on a bathing suit after that diagnosis. Because tell you what, you feel great and fine until you get into a bathing suit and then you're like, whew, okay, I'm fine. I'm not dying right now. This is just anxiety. We're good. But it was also the most helpful thing that I've done is to swim and to be able to move freely without the weight of lipedema, and to also help with compression for my lymphedema. And so the constantly being visible part is a big part of this. Is we stand out in a crowd. Now, I've learned that just because I stand out in a crowd doesn't mean it's a bad thing. It means I have an opportunity to educate people, which is part of the reason why I built this shirt. So it says, these thighs don't lie, it's lipedema. And on the back it says, it can affect 1 in 9 women, could it be you? So the visibility part that I used to shy away from is now something that I'm using as an education tool. And I think it's an important part that if you have these conditions, that if you're willing to, and if you can do that, to be part of that education piece and be visible. We need to know that these people exist, to normalize it, to help other people know that their bodies are normal and okay, and we don't have to change them.